Just a minute. We're going to give folks another minute to go ahead and join the webinar today. Okay, well, thank you everyone for joining. Welcome to today's webinar on integrating your EHR with Workday to maximize the value of your IT investments. I'm your host, Sarah Hickman-Auger. I lead solution marketing for healthcare here at Workday, and I'm pleased to be speaking today with Deb Muro, CIO of Camino Health, who recently underwent a project to integrate their Epic EHR with their Workday system. We're also joined by Ben Morin, Practice Director at AVAP, who worked with Deb and her team to manage the project to completion. And before the conversation. So if you have any questions during the webinar today, go ahead and use the Q&A box at the bottom of your screen to type them in, and we will do our best to answer as many as possible later in the hour. I'd like to start by asking each of our guests to introduce themselves. And so we'll start with you, Deb. Can you tell us a little bit about yourself and about El Camino Health?
Absolutely. One of my favorite things to talk about is El Camino Health. We are an organization in the Silicon Valley. We are almost a boutique type of a hospital where we care for complex patients. We actually, our physicians are from our competitor. They admit to our hospital. So we have a very unique experience, very successful experience. And we were one of the first hospitals in the country to have CPOE, which is computerized physician order entry in 1972. So we have this DNA, and DNA in our DNA is innovation and that spirit of leading edge, which was really kind of proponent of this project that we're going to talk about today. My background is I'm actually a nurse that started taking care of patients and found technology and fell in love with that intersection between technology and the clinician and how to enable clinicians and those that take care of patients to do their work better and more efficiently, which drives all the way to the employee, which is what we're going to talk about today.
Thanks so much, Deb. Yes, it is great to have you as a partner right here locally in the Silicon Valley. And we appreciate your perspective as a clinician. So Ben, can you introduce yourself as well and tell us a little bit about AVAP?
Definitely. So hi, everyone. I'm Ben Morin. So I am with AVAP. AVAP is an IT and management consulting firm focused on ERP and EHR implementations, optimizations, change management, a lot of different areas across a lot of different software systems. My personal background is actually with Epic. I started my career as an Epic implementer, switched to focusing on Workday, and what I really enjoy is helping organizations bring the EHR and the ERP systems together.
That's great. And it's so helpful to have AVAP as a partner that our Workday customers can draw on as a resource for those integrations. Thank you both for being here today. Deb, the last time you joined us on a webinar, you spoke about digitizing the patient experience. Maybe today you can set the stage by sharing your vision for how digital transformation impacts the employee experience and the core processes like HR and finance.
Yes, it's so important that we as technology leaders focus on the end user experience, right? Whether you're a consumer, you're a patient, but especially our employees, which is our most valuable asset. How do we make sure that they have the tools, the technology to really be able to do their role and perform in their role in a self-sufficient manner. And that's the role I like to have, is when I am not dependent on others, that I can really function well within my role. And so the digital transformation is just to surround the employee with technology to make sure that the workflows are frictionless, because a happy employee, an employee that feels that they're efficient, is going to really transcend to your customers and to your consumers. So we realize that the most important time that we can spend is on making sure that our employees have great workflows and that we're supporting that great place to work.
It's a value we have here as well, right? If you take care of your employees, they're able to take care of your customers, in your cases, your patients. So that integration across functions helps a lot with that. So Deb, how did your decision to deploy Workday fit into your vision and the goals you were trying to achieve?
As I started looking at the ERP space, and I've had a history of, actually the conversion usually happens if you implement a new EMR, you modernize your EMR, and the very next thing you're thinking about is modernizing your ERP system. And so that happened at El Camino. And as I was looking at our current system, we were really at a place where we needed to modernize, and we needed to modernize quickly. HR was very sub-optimized in their workflows by using multiple systems that were cobbled together, and they couldn't get data out of the system just to run just a basic report, a question that the CEO had regarding nutrition or whatever. It took just manual processes to bring that data together. So HR was really the first proponent that said, we've got to modernize, we've got to move to a new system. And then, of course, finance was interested as well to do that, in supply chain. So it really came from operations saying, we're not at a good place. We need better tools and technology. And of course, in my role, to matching what their needs were with the best technology.
We hear that a lot from healthcare organizations, that being able to consolidate those siloed systems and have a more efficient flow makes a lot of sense, not just within HR or finance, but even across all the different functions, particularly in the current environment where things are moving so fast and you can't afford to wait on manual processes to get the information you need. So of course, it's also important to be able to do that same integration on the clinical side of the system. So Ben, having worked on both EHR and ERP deployments, what are some of the challenges from your perspective that healthcare organizations face when they attempt those integrations?
Yeah, absolutely. I think the first one that any leader would have to think about is just the resourcing. So unfortunately, I've seen a couple projects where, let's say it's an ERP implementation and the ERP team is taking point. There's no EHR resources formally allocated, and then they get into testing and they say, wait a second, we need to make some changes. And you put one team scrambling to catch up. So just making sure that doesn't happen. Make sure you scope out the work on both sides and have some resources formally allocated from both of your teams. I think that is the number one thing to pay attention to. And then just making sure that you have decision-making that spans both systems. So there will be processes and workflows that are going to be redesigned. Make sure you're looking at the full workflow, not just the piece that's in Workday or anything like that. Make sure you have the full group making the decision so that you can really sketch out the best possible option across all of your systems. And same thing with reporting. There are a lot of business cases that will require data on the clinical side and also coming from Workday. Make sure that you have those identified upfront and you have a solution for joining data together and getting the data that will ultimately support your business decisions.
Makes sense. It sounds like in a lot of cases, the focus is so much on the technical integration that folks don't spend enough time getting the right people to the table or digging into the details of how to reimagine the processes.
Yes, absolutely.
So Deb, with the recent success El Camino had in this area, can you share what were some of the things in your approach that you used to make sure you had the right folks at the table and that they were really considering how they might rethink some of the processes as part of the integration?
As we started on this project and we started thinking about the solution, we instilled governance into that process. So as we were selecting the right tool and technology for us, bringing those governance processes in place. And I am very passionate about governance to help prioritize and make decisions and bring stakeholders in. So we started at the very beginning with that process. And really that gets the buy-in from operations, from HR and from finance and supply chain, that they were part of that decision making, and therefore they're going to be part with you on the journey of implementing. As part of that governance, that we talked about what resources are needed, and we made sure that we had those resources identified and in place, and we backfilled positions that needed to move to 50% or more involvement on the project. We made sure that we had that buy-in and that plan to backfill those positions. And then, of course, having the right leaders in place that are forward thinking is so important. And we had to deal with some of, we've always done it this way scenario. We really had to focus on change management and partner with Workday. I love to partner with leading edge technology vendors to say, we don't want to do things the way we've always done them. How have you implemented this to be leading edge and to bring in the best practices and to throw away the old, bring in the new, and to really reorganize and not let the perfect be the enemy of good. So all of those were processes that we used to make sure that we had the structures in place.
I love the reminder about not letting perfect be the enemy of good, in terms of helping folks with change management, because it is somewhat anxiety producing to think about reimagining all of those processes. But your strategy of having all the stakeholders involved from the beginning, it sounds like it really worked. So Ben, I'm not sure if you have anything more to add on the people side, but I want to make sure we get your perspective on what are some of those best practices on the process side that that partners are bringing in, specifically at El Camino, but beyond that as well.
Yeah, absolutely. I think, some of the big guiding principles that helped us at El Camino was just, we really looked at the implementation of Workday as a chance to optimize. We didn't take anything for granted, like, hey, Epic is doing this, so that needs to stay the same. It was always up for discussion, trying to find those efficiencies. And I was really lucky to have Deb driving that from a leadership level. That made a huge, huge difference. The collaboration that we talked about, we had the joint project planning between Workday and Epic, and then the custom testing scenarios made a huge difference as well. Just making sure in testing that we had scenarios going all the way from, patient checking in to GL transactions coming over to Workday. That was huge. And then efficiency, I mentioned it a second ago, but of course, right, just making sure that we're not taking shortcuts, that we're putting the work in to get people on board with like, no, this is going to be the best solution long-term. Even if it's a change now, just making sure you have that buy-in from the team, that's how we're going to do things.
It sounds like, aligning them on what are the guiding principles behind the process redesign is really important.
Yes.
So Deb, you talked a little bit about this at the beginning in terms of, how important digital transformation is to streamline those experiences for employees. Can you talk a little bit about maybe what were some of the guiding principles that you shared with the stakeholders to get everyone aligned on why the change was going to be worth it going forward?
Absolutely. And, Ben and I spent time on what's our end state? What is our goal at the end of this project that really defines success? I found that that's such a key element to projects, that if you don't define what the endpoint is, then there's a misalignment of did we get there or not? And so we spent time with Workday and with our leaders understanding what our endpoint was. And our endpoint was obviously to make sure that we were bringing in a technology that could help optimize and run the business, as well as create this self-service capability for our employees and analytics. Those were all really important endpoint states for us. I think the other challenge that CIOs and other leaders have is using those core apps versus bringing in best of breed. When I first started my career, it was best of breed, then it moved very much to core apps. And now I'm starting to see a little bit of moving back to best of breed. And I think it's so important that when we're all managing cost, especially with COVID now, that we're thinking about technical debt and we're thinking about how do you optimize those core applications, EMR, ERP, ITSM systems, and making sure that you are using those systems to the fullest. And so we spent time really thinking about how to optimize those products. We brought in a product to help us with our provisioning and identity and access management that supported cyber. And so linking all of those into a very coordinated workflow was so critical for us and important for us. And then, of course, reducing those manual processes as we have to become more efficient in the world that we're in today of reducing cost. It's so important that we're removing the waste in our organization. We're a lean organization. We adopt performance improvement initiatives. And it's so important that with this project that we did that as well.
Certainly that principle of efficiency, eliminating waste, which I think folks have done so much work on, but also finding new ways to eliminate manual processes. Certainly today you just don't have the time to spare on anything. So I think that makes a lot of sense in terms of keeping folks aligned on that. So Ben, in terms of achieving those goals around eliminating those manual processes and working toward efficiency, what are the core areas of integration that organizations should be focused on in order to get the greatest value from their efforts, right? It's rare that we can afford to stop and do everything all at once. So, in terms of prioritizing, what are the key areas of integration to really think about to get the biggest value for your effort?
Yeah, well, I think there's really three overarching areas where the ERP and the EHR come together that any leader should be thinking about. The first one is finance. So in healthcare, the EHR is responsible for almost all of your revenue. And so that GL integration between, in El Camino's case, Epic and Workday is going to be huge to just make sure that your ultimate financial statements have everything correct from the activity that happened in Epic. For supply chain, similar, very critical. Workday is going to hold all of the item information about the supplies and everything else that you need. And then your EHR system is going to need to read all of that, document what providers are using during their procedures, and then go back to ERP and say, hey, we used X number of scalpels, get ready to reorder because inventory is running low. So that's a huge process as well. And just getting some of those things automated where the inventory management is really happening efficiently, that's a huge win for the organization. And then business intelligence and reporting, we talked about this just a little bit earlier, but it really supports good decision-making if you can get the data joined and in a readable format from the two systems. So the example we like to use is a certain service line profitable? You need information on the equipment, the rooms, the employees from ERP, but then you need the procedures and your ultimate reimbursement that comes from the EHR. Just making sure you can join those pieces of data together and get some integrated reporting is a huge win.
Good advice. I know Deb mentioned the value of trying to streamline access to reporting, and certainly the benefit of having that broader perspective when you join the data together, as well as just simplifying the core financial processes.
Yeah.
Deb, is there anything to add from your perspective, particularly around finance or business intelligence, and how the integrations came back to those guiding principles and what you were most excited about there?
Now, let's be clear, this project is high visibility. And as Ben mentioned, your financials go right to the board. And if there's any risk of that data not being accurate, it's high visibility, high risk. So, we are also an organization that has adopted data analytics. We're very engaged with our ERP system, our EMR system, on a web-based dashboard. So the C-suite has at their fingertips a real-time dashboard that drills down to service line, number of expenses per day, revenue per day, surgeon revenue. We go all the way down to the very deep, dark elements of data analytics. And it was so important that our ERP system contributed to that, so that any moment in time, the COO can put a report together for the C-suite on how we're doing today. And we have really benefited from the Workday with the cloud-based product, the upgrades that we've been able to take quarterly or on a very often basis. We don't get out of date, out of support, out of sync. So that's all been value added that I don't have to worry about staying up to date, but that's something that happens due to the cloud-based nature. And then, of course, we're very engaged in predictive analytics. As we're thinking today about possible surge, and our county is going to lockdown mode for COVID, we need to have at our fingertips our supplies, our resources, how's our financials doing, all of that data. And the ERP and the EMR system are those workhorses that provide that data so that you can run your business and make real-time decisions moment by moment as you're dealing in a pandemic.
I think it's a great point. We were just chatting before the session began about how rapidly things are changing with the pandemic and differently in different areas of the country. So being able to see directly, what's happening with your organization and forecasting for your community is so important right now when things are changing so quickly. So, we mentioned a little bit earlier the supply chain side of things in terms of integration, and of course that's very important right now as well. Ben, I understand AVAP has certified on a particular maturity model to guide supply chain integration. Can you tell us a little bit about that?
Yeah, absolutely. So it's actually a HIMSS model similar to the HIMSS Stage 7 that some of the audience is probably familiar with. This one's a little bit newer. It's called CSOM, which stands for Clinically Integrated Supply Outcomes Model. So it's similar to the other HIMSS maturity models where it really evaluates how close to the potential of the technology is your organization, right? And it helps you identify areas to improve. So this one really focuses on being able to track your supplies and inventory all the way up to the point of use, making sure you have the inventory management where things are decremented automatically and you have a very clear picture of supplies at any given time. So I know we don't have a ton of time to go into it, but I would really encourage the audience members who are interested into supply chain to go do a little bit more research. I think CSOM is a great tool.
Thank you for the background on that. Certainly having those maturity models as a guideline to help folks along their journeys is important because you can be really clear about where are we today and where are we trying to go and all the steps in between, because it is a journey, right? You have to walk before you can run. So it makes a lot of sense to have that as a guidepost for folks to look at.
Definitely.
So Deb, I know you mentioned that supply chain is important to you as well. Can you just give us a couple comments on how that fits into your overall vision of what you've achieved so far with integration?
Sure, absolutely. So, we the beginning of our project, we focused on HCM and finance. and all the integrations. I think we've completed about 150 integrations as part of that project. So very in-depth project. And now we're moving into the supply chain part of our project, and we're excited about that. We've done some work in cleaning up the item master, making sure that we are, I always call it the runway. So, what's the runway that we need to be on to make sure that when we take off on this project, we're ready to go. And I love spending time on those initiatives that help you do things to enable your project, such as cleaning up the data in your legacy application. So we've been involved with that. Ben's been instrumental in leading us. I'm excited about the CSOM model that Ben just spoke about, so that we can make sure that we're engaging for success as we finish this last part of our project.
Great advice about thinking about the runway, right? Because things don't start the day that you start the integration. It's really about getting prepared to make sure you're ready to take on those projects. So I think that's great advice, and we're excited to work with you on the next phase of the journey as well. So let's see. I think one of the things you mentioned in terms of rethinking everything and leveraging the modern technology you have to redesign processes and in terms of unlocking the return. Do you have any results so far, or could you share a little bit in terms of your perspective of how the Workday deployment delivered in general on what things you were trying to achieve with the new with replacing your previous ERP system, and maybe any of the benefits that you've seen so far that are specific to the Epic integration?
Absolutely. So, I love vendor partners that help us on our project. And currently we're completing a value analysis that Workday's leading to really help us think through how did the project end. We delayed this a little bit because of COVID, but we're completing that work now to really finalize. We had KPIs, we had measures of success. How do we really deliver on those? I'll tell you anecdotally, without specific data, we know that we've got better analytics and that we can provide that data in one system versus 5 or 6 cord together. We did our evaluations this year in Workday. We are doing all of our open enrollment. We've moved all of these applications into a core platform. And I'll tell you, it's very easy to use. And I've received so many comments from employees stating that it's so much easier to use, and it's nice to go to one place to see your paycheck, to see your open enrollment data, to see your new positions, to see your evaluations and how to manage your team. I think all of that at your fingertips in a very easy to use system has been extremely helpful. Analytics is another, as I mentioned, having that data at your fingertips. We are always working on a faster time to close. Before, it was much more elongated. We're working on the integrations, as we've talked about with the EMR and ERP system, make sure that goes as quickly as we can, and eliminating manual procedures and processes. We have a CFO now that's very focused on that. I'm excited to see where we're going to go in the future. And, again, self-service for our employees. Everyone wants to deal with their issues themselves without having to call the help desk. Who wants to call the help desk or call someone? And so, having that ability for, sky's the limit. We're going to be moving towards having, staff order their own equipment when they're onboarding. All of those things are in our future, and we're excited about that. And it all brings ROI from an employee satisfaction to an efficiency standpoint.
That's really great to hear. I know it's a common theme for Workday customers being able to reduce time to close. So I'm happy to hear you guys were able to benefit from that. And then, thinking about how important self-service is, especially now that so many folks are working remotely, right? Being able to serve them that way, that's a great example. Thank you for sharing that. So, we've talked a lot about how Workday helps organizations adapt to the changing conditions, surfacing that real-time data, reducing time to close, the ability to reconfigure processes, upfront, sort of rethink them, and then, of course, the flexibility to do that along the way. Um, I think maybe the thing folks are most excited about when they think about a replacement is achieving the efficiency and freeing up operational staff for other things, which I would imagine has been really important in recent months. As folks who are listening are thinking about embarking on a similar project to achieve some of these things, I think it would be great if you could share what advice you would give to them. And maybe we'll start with Ben and then come back to Deb. Ben, I think you're on mute.
Sure, and thanks. Absolutely. I know I keep coming back to it, but just making sure that you have the resources allocated from both EHR and ERP. I've seen the adversarial relationships, and it's really not what you want. So just making sure that's all set at the very beginning. And then going back to Deb's point about governance, I mean, really for El Camino, that was the thing that got us through. We had issues like any other project, but just having Deb there, having the buy-in from all the executives, and having the structure to triage the issues and really work through them, that's what let us work through everything and ultimately be successful. So I would say those are my biggest recommendations to anyone thinking about a similar project.
Great advice. Thank you for that. And Deb, what about you? What are your thoughts in terms of final advice or recommendations that you would give to other organizations who are maybe earlier on their journey than El Camino Health?
ERP project it's a challenging project because when you implement an EMR system, you're generally everyone's on the same page what the goal is and what you're trying to accomplish. An ERP system, you have finance that has very different goals versus HR, which has very different roles. And then you have supply chain, again, very different roles. And as you're thinking about that, it takes leadership to pull those three very distinct groups together to come together and have a common guiding principles, as we've mentioned, aligning with the strategic vision of the organization and making sure we're all on the same page and we're allotting resources. And so the governance was critical. We had weekly meetings with our leaders to talk about risks and issues and help them problem solve. And so I think the CIO really, unfortunately, has to lead this quite a bit to make sure that you're pulling all the components together. It took quite a bit of my time to bring those folks together. But once we had the governance in place, then it was much easier. And so I would say, be ready for, as a CIO or as a leader leading this project, pulling the right people together, getting that governance in place, and having quick and effective decision making is so critical.
That makes a lot of sense, that it's really worth the investment up front from leadership to get governance in place and sort of the structure that allows your team to succeed moving forward, and then the project goes much more smoothly. So thank you for those insights. So we have a few questions and we left time at the end here. If anyone has additional questions, you can use the Q&A box at the bottom of your screen to chat those in. And I'll go ahead and start with some of these. So the first one is really detailed on the finance side. So we'll ask you, Deb, and then Ben from actually managing the integration work, if you want to chime in. But a question about what specific dimensions or work tags were you able to bring in for your patient billing and payments with the integration between Workday Finance and the EHR?
Yeah, I can take this one. So we actually took kind of a two-pronged strategy. So for the GL specific transactions where we're bringing revenue from Epic over to Workday, we took summarized information. So at each combination of dimensions. So, in Epic, they call this a GL string. In Workday, it would be each combination of company cost center and work tag. We would just have total debits and credits that would come over to Workday. Then we actually had a second integration that brought much more detailed information over to populate for analytics and reporting that came out differently. And on that side, we actually had every single transaction that took place in Epic. So every charge, adjustment, and payment with all the information that went along with it. So, patient name, revenue code of the procedure, insurance, everything like that. So it was quite a lot of work, but that was the approach we took.
Thank you for those details. So another question, I think this is probably, well, actually, I'm not sure if this is for Deb or Ben, but in terms of, Deb, you mentioned that you guys had already started sort of looking at item master cleansing for Epic, and Ben, you might be able to chime in here in terms of best practices. Who does it make sense to have involved directly with that supply chain management ERP transfer to Workday, and specifically starting with the item master cleansing? What are sort of the best practices there to manage that?
And I'll let you start and I'll finish. How's that sound?
That sounds good. Yeah, so in terms of cleaning the item master, it's really going to be your supply chain team. So the key people would be, your supply chain manager, inventory analysts, procurement specialists, people like that. They're usually the ones who know the item master the best and can point you in the right direction. A lot of what we mean by cleaning is getting rid of duplicates, making sure that all the information is updated. If we have a supply that we've been using for 10 years, a lot of times something has changed, but hey, we haven't really worried about it because it's been working, but you want all of that to be accurate when you move it into Workday. So we started doing that at El Camino, and then at the same time, you can start to do the CSOM process. It starts with just a survey to some of your supply chain SMEs and leaders, just asking about different aspects of the supply chain. And so we kind of have those two tracks running in parallel on the runway that Deb mentioned earlier.
Yeah, and I would say it's very similar to your EMR project where you're cleaning up your patient list, right? You're cleaning up, before you want to actually convert data over. It's so critical that you're cleaning that up. And most of us, unfortunately, don't do that well on an ongoing basis. We wait till we're doing big projects. My goal would be to do it, more often, but it's certainly the best time to really get your data clean before you start on the initiative.
Good advice. Going back to the runway comments you made earlier. Thank you, Deb, and thank you, Ben. So Ben, I'm not sure if you have a specific answer on this, but is there an average in terms of the number of supply chain management subject matter experts that you need to depend on, or is it really just about making sure you have those key roles that you mentioned covered in terms of assisting with the ERP EMR project?
Yeah, I would say it really depends. I mean, it depends on the size of the team. First and foremost, a large organization is going to have a larger supply chain team. I personally support at least some level of involvement from almost everyone on the team. Usually you'll have one or two folks who are really primary on a Workday implementation, helping the consultant set up the system, and then a lot of other folks who are SMEs just contributing their knowledge. And so I like to have the SME group be as broad as possible just to make sure we're not missing any of the perspectives from the team. But yeah, I would say that's typically the standard. You have a couple folks who are really dedicated to working with implementation consultants, and then the rest of the supply chain team would act as subject matter experts.
That makes sense. Coming back to about the size of the team and just making sure you're representing folks. So another question, where do the detailed Epic transactions get placed? Are they in Prism Analytics or another Workday location in terms of, opportunities for supporting analytics?
Yeah, that's a great question. So for El Camino, they actually went into a third-party decision support. We didn't have Prism as part of our phase one, but it is something that I know, Deb, we've talked about a couple times and interested in for the future. But they can go into Prism. So for the customers that have Prism, yes, you can place them there. And then along with the data coming from Workday, as long as you have the key data elements where you can link them up, then you can do your joint reporting from Prism.
Great to have that benefit of integrating the different data sources so that you can get those dashboards and reports directly in Workday with Prism Analytics.
Yep.
So Deb, you mentioned earlier in our conversation that, it was important to you to have partners who could bring best practices to the table. Do you have any advice about selecting a partner for ERP deployment or for integration for that matter that you could share?
Well, I always, move in the direction of working with partners that I know and trust. And so it's why I, selected AVAP to help with this initiative and to help us roll this out. As we were thinking about professional services as part of this project, I found that it's so important to stay closely aligned with the vendor that wrote the product. And so we relied on Workday to provide resources as part of the project, professional services in conjunction with AVAP. I think there's various options of bringing in a third party. I think bringing in third parties for change management sometimes makes sense because knowing what those best practices are in healthcare, if you can find a group that is very attuned to that more than likely is a good approach. But we were able to work with Workday to bring in those resources to help us. And then Ben and AVAP were helpful to round that out from a project management standpoint. I do think that the change management piece, we would have benefited maybe from more expertise in that area. And if I were to do it over again, would really seek out who's going to be able to provide some change management because it's so hard when you're moving from manual. We had a controller that had worked here for 40 years, and to try to talk to someone about leading edge best practice, you almost need some expertise to come in and help have those conversations because people want to just stay the way they've always done things. And so it's so important that you have that ability to talk about, well, you've always done it this way, but let's talk about what the future can hold and how that can benefit you. So
good advice. So, the folks who are close to the software and understanding the integration, folks you've worked with, and trust, and then folks who are able to maybe push a little on those stakeholders who you really need involved, but you need them to sort of step out of their comfort zone for the project. So one last question for Ben. We have folks on the call who are sort of in different stages in their deployments. Are there any different considerations for organizations who are evaluating integration from an optimization perspective versus an initial ERP implementation perspective?
Yeah, that's a great question. I mean, I think the core message is the same. You want to make sure you have the joint governance, make sure that you have decision making with both teams involved so that you can get processes that make sense between the two systems. I do think there are some specific things that are a little bit different. One of the big things that we dealt with at El Camino right after go live was having a joint process for updating cost centers. For instance, cost centers live in Epic, they also live in Workday. The processes were different before. So, someone updated a cost center in Epic. Now we have an integration error because Workday doesn't recognize this number, right? So just things like that, the maintenance processes, those become more important after you're live, and just making sure that you spend the time, have the process for updates that covers both, and you're not leaving one system behind. I think that becomes even more important with optimization.
Thank you. That's helpful as folks are sort of considering where they're stepping into this.
Yep.
So we are out of time for today. I want to extend a big thank you to both of our panelists for the discussion. It's so great, Deb, hearing firsthand how the integration between Workday and Epic is supporting your overall strategies at El Camino Health, delivering more automation for improved visibility, the enhanced analytics, and then of course those optimized processes for efficiency. And then we really appreciate the details that you are able to offer in terms of the integration process itself. Thank you to all of our attendees for taking time out of your day when it's so crazy right now to spend some time with us on this topic. We hope you took away some great learnings, and we'll be posting this recording on our website in case you want to share with any colleagues who weren't able to join today. And thinking about all the frontline workers at your organizations who are helping care for folks right now, just a big thank you to all of them, and stay safe, and thank you. Take care.
Thanks, everyone.
Thank you.